And Utah's major healthcare providers rely heavily on virtual visits to help prevent the spread of coronavirus.
Fox 13's Haley Higgins is live in Salt Lake City this evening with a look at how those virtual visits help. Haley.
Yeah, well, it helps by keeping the patient at home. They can talk to a healthcare provider from their phone, but that keeps them away from the facility, doctors, and other patients.
Welcome to Connect Care. How can I help you?
Critical health care happening at Connect Care's main hub in Murray.
I'm worried about the coronavirus going around.
Stay home while you're sick so you don't expose yourself to others.
Intermountain Health's 15 providers take on extra shifts under the threat of a widespread outbreak of COVID-19 in Utah.
There's concern.
Since the weekend, the number of calls coming to Connect Care are up by a third. Just yesterday, 30 people called in with concerns that they may have coronavirus. 9 were serious enough to be evaluated for testing, according to Intermountain Health.
We run what's called a heat map, and we staff according to busier times of the day. We have more providers on.
Similarly, University of Utah Health's telehealth program has also seen a, quote, dramatic increase. It's important, according to infectious diseases director Todd Vento, who says technology is an effective buffer for the virus.
We certainly want to try to minimize any potential exposure within healthcare systems of COVID-19 so that we don't then have to deal with outbreaks within healthcare facilities.
When the first Utahn was suspected of having the virus, first contact with healthcare workers was through Connect Care. Then staff contacted McCady Hospital to prepare the patient for testing.
The McCady staff did a very good job of keeping that person isolated from others so they wouldn't expose others or healthcare workers, and bringing them into the facility already thinking that they could have COVID infection, which they then later were shown to have.
Reaching out through technology first to make it safer for everyone. Now, hospitals are also using telehealth technology to talk to patients that are in their care instead of having attending nurses and doctors have direct contact with COVID patients. They're using this technology to keep some distance and, of course, lessen their chance of getting sick. Reporting live in Salt Lake City, Haley Higgins, Fox 13 News, Utah.
All right, good idea.